Yeah, thanks, Stephen. Yeah, I'm mainly going to focus on COVID, but I think that I want to see as much discussion as possible, and it can be quite wide ranging. So I'm going to start with some news articles that you probably quite a lot of you've seen, but some of them might give you a giggle, some of them are more serious, just to kind of get us into thinking about how the state has acted in the current crisis. And then I'm going to kind of go on to some points about the contradictions and possibilities that I think the crisis can offer us as socialists. So that's my screen. I think everyone can see it, hopefully. This, you may have seen that there was a Twitter. There's a tweet from South Yorkshire Police going on and on about different people like having a walk in the countryside, and sort of moralising about the evils of that. I'm not agreeing with it by any means, but it was quite comical in the sense of, is this really what you are going to spend your time doing? People may have remembered, may remember this tweet from Cambridge Police that caused quite a lot of outrage, and it led to the government having to clarify that yes, you were allowed to buy Easter eggs, and buying Easter eggs wasn't actually illegal. This one was, I remember seeing this video of a guy in his garden being told that he wasn't allowed to stand in his front garden, and the police officer being extremely like moralising about it and kind of telling him off, and them having to then apologise. And to be fair, like, I think what it showed was how rushed a lot of things were in the government's approach, how a lot of police forces were like very inconsistent in handling it. There was kind of very limited guidance, and it was, and even the guidance that was there was being followed in kind of myriad different ways. So this is more kind of these are the more kind of alarming slides. So people have probably seen these kind of findings, coming from the Met Police's own data. So you're about twice as likely to be arrested during lockdown if you were black, and black people were very disproportionately fined as well. There's this really interesting quote from, he kind of is now like a campaigner, but he was formerly a police officer, Leroy Logan, and he said, "I can't discount that these figures exhibit a racial bias because practically everything the Met does has a racial bias. The Met is institutionally racist and the use of COVID powers is part of this." So obviously the way that this crisis is being kind of overseen, and the way that it's been handled by different arms of the state, including the police, has had a lot of horrendous consequences, particularly for working class people, and particularly as well for people of colour. There was kind of just at the start really of the lockdown, there was an eviction that the police in Brighton attended, arguably took part in, where some very clinically vulnerable people were actually evicted from an empty pub. They were sort of not really doing anyone any harm, just keeping them to themselves. And I've noticed this actually when I walk around. I live in Wood Green, and I noticed that a few weeks into the lockdown, there was a lot less visible street homelessness, and there were a lot of articles that you've probably seen published about the fact that it was called the Everyone In scheme, which pretty much ended at least 90% of street homelessness overnight, and it only cost £3.2 billion, which is pretty, really quite a small amount. And that's, even if you consider like all of the effects of austerity and everything, I think it's not too much to ask that we just house people and, help them get treatment if they need it. And it's really kind of showed that it's not actually that difficult for them to solve this problem. So this kind of leads me on into talking about some of the contradictions of the current crisis. So as we all know, we were strongly advised to stay at home and work from home if we could, but there was never a point at which non-essential work was stopped. There was never a point at which employers were told that they couldn't bring in their employees. So essentially, if your employer was still expecting you in, unless you were sort of shielding, you had to just do it. You had to just go, and it must have led to thousands of more deaths, simply due to the fact that people were having to travel around more, were having to come into contact with more people, and all of that. So that's a major contradiction. There obviously were mortgage holidays, but not rent holidays for those of us that rent. There's kind of a huge crisis in care homes. A lot has been written about, and there have been some really interesting programs about this. I listened to one on BBC World Service, and it kind of showed how little the government had thought about care homes, how little they had planned for kind of dealing with the crisis in care homes, how little they'd thought about the reality of what it would be like for care workers and the people they care for. So that was quite a major thing. And also as well, the fact that there were so many agency care workers who go into people's homes and work, who were just basically offered nothing, and for a while it looked like they wouldn't even be getting proper sick pay, but that there were kind of concessions won on that. I'm a school worker, I'm a teacher, and what we've seen is that a kind of strong rush to try and get kids back in. And there's been a sort of line peddled that it's all about their welfare, but it seems that the real priorities is not trying to get vulnerable students back in, or students who don't have internet access at home, for example. It's actually about getting students in who are really young, in primary, who therefore their parents can go and work, or about getting in secondary, which is what I work in, getting in year 10s and 12s, so that we can prepare them for the, extremely important tests that they have to do at all costs. So that's a contradiction that's been shown, I think, particularly as, it was obviously possible to cancel tests. There's no need for them, I don't think, in the way that they're done currently. And it's a culture that is incredibly damaging to young people's mental health and needs to end. Full sick pay was always possible, and it's something that we should continue to demand. A much stronger benefit system was always possible, and the government schemes, even with all their inadequacies, showed that it's possible to spend money to look after people. It's possible to borrow money, and it's possible to tax the rich as well. It showed who the kind of real essential workers that keep the country going are: people who work in health, food, care, transport, logistics, education. Not to kind of discount like other workers, but it kind of showed how important some of those jobs are. Whereas nothing collapsed due to rich people staying home and having to tutor their own kids. It was the people who do all of those kind of services who we rely on, and a lot of those people are often migrants, particularly in logistics and care and health as well. There was an obvious contradiction in people being condemned for going on protests, Black Lives Matter, but also at the same time being told that they have to go back to work, and then soon after being told that they might be able to have a holiday in Spain. It makes no sense. It showed the bizarreness of the way the pharmaceutical industry works and how illogical capitalism is in this regard, that we should be working together to end pandemics and health crises, not to patent medication. I think the more kind of silly articles that I maybe showed at the start, but also the more kind of stark statistics about the policing of Black people particularly, shows this, like, who do the police think they are? What do they think they're doing? And why do they exist? What are they for? I think the way that they handled this crisis, I think it has probably had an effect on the Black Lives Matter movement in the UK. Because the way that they policed it bluntly was racist. And also, I think it shows that they are in some ways very not very useful even in the things that they're meant to do properly. And then there's also this kind of sudden interest in the attainment gap in schools and in child poverty, and in, we have to get all of the children back in immediately, but only in these year groups. And I've explained already why those specific year groups maybe were the first two that they wanted to bring in. Child poverty has been getting consistently worse for a couple of decades, basically, or at least since the last Labour government. And there's not been that much interest shown before, so it's only kind of, they've started showing an interest basically to bash school workers. So those are some of the contradictions. And then in terms of possibilities, I won't talk for much longer because I've mentioned some of these already, but I think these are kind of based on workers' liberties demands about the COVID-19 crisis, which I'd recommend having a look at on our website. But essentially requisitioning private sector healthcare beds, and I've not mentioned there, but pharmaceuticals as well. Ending street homelessness, significantly reducing housing insecurity is actually not that hard. Proper sick pay and a proper welfare system doesn't, it's the money is there, an end to high stakes testing in schools, because actually a lot of the time we can, education professionals can provide judgments about how students are doing, but also like what are those exams for exactly? Like, why are they so necessary? As I said, who really keeps the country going? Like, I think we should try to make propaganda around how important the contribution of migrants is, particularly in the health and care sectors. We should be arguing for pay rises, to scrap racist policies such as no recourse to public funds. publicly funded medical research for public good. Lots of labs have been turned over into research facilities and testing labs and things like that. I'm not saying that I think that should happen to university labs at all, but I do think that there's a much bigger role that the state could and should play in funding medical research after this crisis too. And finally, emptying prisons of non-violent criminals. So we talked a bit about prisons in our session on prisons, but roughly 69% of women in prison haven't committed a violent crime, and a lot of male prisoners haven't committed violent crimes either. The prison system is very, very racist, and there was a kind of COVID-related crisis in prisons where, the conditions were either meaning that they were keeping prisoners in kind of separate for longer and only allowing them very, very short breaks, which is incredibly bad for their physical and mental health, or they were kind of allowing COVID to kind of run rampant. And there's just no need to have this many prisoners. Like we have more prisoners than per head of the population than any other country in Western Europe. It's just obscene. And I think that would have, I think emptying prisons of non-violent criminals would save money and be better for everybody. So those are some possibilities.